What if I told you that masturbating every day after 60 could be quietly reshaping your prostate, and not always in good ways? I'm Dr. James Ellison, a board-certified urologist with over 30 years of experience helping men protect their health, performance, and confidence as they age. For decades, we believed that regular ejaculation was only beneficial. But new findings, and what I've personally seen in hundreds of patients, suggest there's a hidden side to daily masturbation in older men. One that triggers strange and often overlooked changes in the prostate. In this video, I'll reveal 4 surprising changes that happen inside your prostate when you masturbate daily in your 60s and beyond, including what's helpful, what's harmful, and what you must watch out for before it becomes a serious problem. And the 4th change, the one almost no one talks about, might be the key to saving your confidence, your comfort, and your independence as you age. Don't miss it. Before we dive into these vital insights, make sure to hit the subscribe button and turn on the bell so you never miss another honest doctor-backed tip for men's health over 60. If you find this video helpful, type 1 in the comments to let me know it resonated with you. If not, type 0. Your feedback helps me serve you better. Let's start with the first and perhaps most overlooked change that occurs when older men masturbate daily. What it quietly does to the pelvic floor muscles and the prostate itself. Over time, even something that feels harmless can lead to subtle strain. And in men over 60, that strain can have very real consequences. 1. Pelvic floor fatigue and prostate irritation. Let me take you back to a conversation I had with a patient named Robert. He was 67, sharp-minded, active, and had taken pride in keeping up a consistent routine of daily masturbation. "It keeps me young," he told me with a grin. But underneath that smile was a quiet discomfort, one he had ignored for months. Pressure in the pelvis, frequent nighttime urination, a strange tingling during orgasm. "Just aging, right?" he asked. But it wasn't just aging. It was something I see far too often. The slow, silent fatigue of the pelvic floor and the irritated prostate that comes with it. You see, the prostate and pelvic muscles are involved in every ejaculation. They contract rhythmically to expel fluid. And when you're in your 20s or 30s, your body recovers quickly. But past 60, things change. These muscles are no longer as resilient. Daily strain from frequent ejaculation, especially when done with no variation or rest, can begin to wear them down. The result, low-grade inflammation around the prostate, minor at first, but persistent. Over time, this inflammation becomes chronic and it doesn't stay quiet forever. The sensations begin subtly. A dull ache in the perineum, a heaviness near the bladder, a weakening of urinary flow. Then come the late-night bathroom trips, the sense that you never fully empty your bladder, the discomfort during or after sex. And if you keep ignoring these signs, the inflammation can evolve into a more severe condition, chronic non-bacterial prostatitis. This isn't just annoying, it can derail your quality of life. I've watched men become prisoners of their own bodies, embarrassed, anxious, and in pain simply because they believed a private habit couldn't possibly have serious consequences. That's the price you pay, not just in comfort, but in freedom, intimacy, and peace of mind. The quiet toll of daily strain becomes a loud disruption to your days and nights. It's a hidden cost that most men don't even realize they're paying until it's far too late. But there's more to the story. Because what if I told you that beyond physical strain, this daily habit may also be triggering internal changes that affect your hormones and may even fuel the very condition so many men fear as they age?
Let's talk about that next. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now, let's move on to point number 2. 2. Hormonal imbalance and DHT sensitization. I remember one man in particular, Alan, age 70, a retired engineer. thoughtful, and disciplined. He came to me not with pain, but with frustration. "Doc, I still have the drive," he said, "but I feel off. My moods swing. My hair is thinning faster, and my urination has gotten strange, slow, uncomfortable. Could it be just stress?" But it wasn't just stress. It was his hormones shifting in ways he didn't fully understand and being pushed further out of balance by his daily habit of masturbation. Most men are surprised to hear that ejaculation affects their hormones. They assume it's all downstream, just a release. But inside your body, especially after age 60, it triggers a cascade of hormonal responses. Testosterone, the hormone of strength and masculinity, begins its natural decline. But a more aggressive hormone, DHT, or dihydrotestosterone, remains potent. In younger years, this balance isn't a problem. But as testosterone dips and DHT becomes more dominant, the prostate becomes more sensitive. And here's where the trouble begins. Frequent ejaculation causes a brief drop in DHT. But what many don't realize is that this drop is followed by a compensatory rebound.
It's the body trying to restore balance, but in older men, it often overshoots. Day after day, this hormonal whiplash, rise, fall, rise again, creates a heightened sensitivity in the prostate. The tissue thickens, enlarges. You may not notice it at first, but the symptoms creep in. Difficulty starting to pee, a weak flow, urgency that comes out of nowhere, and silently, benign prostatic hyperplasia begins to take root. This isn't just a nuisance.
The price you pay here can be deeply disruptive. Waking up 5 times a night, always scanning for the nearest bathroom, the anxiety of not being able to empty your bladder in public. For some men, it goes further. Urinary retention, catheter use, and in extreme cases, surgery, all triggered by a hormonal imbalance you never saw coming. And here's the unsettling part. This hormonal chain reaction doesn't just affect your prostate. It affects your sense of manhood, your mood, your confidence, your clarity. The more this pattern continues, the more off-center you feel emotionally and physically. It's not just a gland anymore. It's your whole self being thrown out of rhythm. But the effects of daily masturbation don't end with hormones. There's another danger, one that creeps in quietly and steals something even more personal, your awareness of your own body. Let's take a closer look. 3. Desensitization and missed warning signs. One of the most heartbreaking moments in my career came from a man named Carl, 73 years old. He sat in my office with tears in his eyes. Not from pain, but from regret. "I thought I was fine," he told me. "No blood, no pain, no reason to worry. But now I've got prostate cancer, and it's already spread." I asked if he had noticed any changes over the past year, even subtle ones. He paused and then said, "Well, maybe. Things felt different during climax, weaker, less sensation. But I thought it was just age." It wasn't just age. It was his body trying to warn him. Daily masturbation, when done mindlessly, becomes more than just a routine. It becomes a form of emotional and physical tuning out. The very act that should help you stay in touch with your body becomes mechanical, predictable, and dangerously dull. You stop paying attention to the details, the color of your semen, the intensity of your orgasm, the pressure behind your ejaculation, or even new aches that weren't there before. These aren't just details. They are early signals, signs your body sends when something inside is starting to shift, sometimes dangerously. So, this desensitization isn't just about diminished pleasure. It's about the slow erosion of self-awareness. When you no longer listen to your body, you lose your greatest line of defense. Prostate inflammation, infection, even cancer. They all begin quietly. And if you're numb to your own sensations, you'll miss the whispers before they become screams. The price you pay is steep. I've seen men discover tumors too late because they ignored the signs, believing they were just getting older. I've seen lives upended, marriages strained, and confidence shattered because the early warnings went unnoticed. Not because these men didn't care, but because they stopped noticing. The cost isn't just physical. It's the emotional blow of realizing you had a window to act and let it close. And it doesn't stop there, because when a man becomes disconnected from his own body, the next risk is even more profound. What happens when that daily habit, once private and harmless, starts to replace something far more vital, human connection? What if the most dangerous change isn't physical at all? Let's talk about it. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now, let's keep going with point number 4. 4. Emotional isolation and self-neglect. I once had a long conversation with a widower named Frank. He was 76, lived alone, and had no close family nearby. He kept to himself, filled his days with routine, and told me he masturbated daily, not out of desire, but out of habit. "It helps me pass the time," he said. "It keeps me from feeling alone." What struck me wasn't what he was doing, but what he was avoiding. Behind his soft-spoken words was a deep sense of isolation. And what started as a form of self-soothing had become a substitute for something he desperately needed: connection, meaning, purpose. This is something I see often, though it's rarely spoken aloud. For many older men, masturbation becomes more than a physical release. It becomes emotional anesthesia. It numbs the loneliness, the grief, the slow passage of time. And over months, even years, it can quietly replace real human contact, emotional intimacy, and even the will to engage with life. The danger here is not in the act itself, but in how easily it can become a way to disconnect from everything else that matters. The price you pay is far more than discomfort. It's disconnection. Emotional self-neglect doesn't just affect your mind. It weakens your entire sense of identity. I've seen strong, capable men slowly lose their spark. They stop reaching out to old friends. They pull away from their partners. They stop attending appointments. And worse, they stop listening to their bodies altogether. Without realizing it, they start disappearing from their own lives. There's a deep loneliness that grows in the absence of meaningful touch, conversation, and companionship. Masturbation, when done without intention, can mask that void for a while, but it doesn't fill it. Over time, it can even deepen the emptiness, making it harder to reconnect, harder to seek help, harder to care about your own well-being. That's the most dangerous change of all, because it doesn't show up on a lab test or scan. It shows up in your spirit, in how small your world becomes when you stop valuing yourself enough to stay connected, stay engaged, stay present. But it doesn't have to stay that way. There is a better path, one that includes self-care without self-neglect, connection without guilt, and strength without shame. So, what should you do instead? Let me show you the way forward. 5. So, what should you do instead? If you've made it this far, let me first say this: you're not alone, and you're not broken. The fact that you're here listening means you care about your health, your future, and your life. And that matters more than anything. I've spent decades working with men in their 60s, 70s, even 80s. Men who are trying to navigate aging, sexuality, loss, and self-worth all at once. The ones who thrive, they're not perfect. They're not immune to loneliness, habit, or health issues. But they choose awareness over avoidance. They choose care over guilt. And most importantly, they choose connection with themselves and others. So, what should you do instead of falling into a daily routine that may be quietly hurting more than helping? Start by shifting your mindset. Masturbation is not the enemy. Disconnection is. Use the act not as an escape, but as a moment of mindfulness. Slow it down. Pay attention. Make it a check-in, not a checkout. Your body will tell you when something's changing, but only if you're listening. Space it out. You don't need to prove anything to anyone. 2 to 3 times a week can be more than enough to support prostate health while giving your body and hormones time to recover. Make the experience intentional, not habitual. Choose a time and space that feels calm, safe, respectful. Let it be an act of care, not a cover for emotional pain. Rebuild connection. If you're feeling isolated, reach out. Talk to a friend, call a relative, join a community. Even if it's small, human contact isn't just good for your heart. It's good for your hormones, your sleep, your will to live. If you're in a relationship, don't shut your partner out. Let them in. Share your struggles, your desires, your fears. Intimacy doesn't always have to be sexual, but it should always be honest. And please get checked. Don't wait for pain or blood to take action. A simple PSA test, a quick exam, it can make all the difference. Prevention is still the best medicine, and awareness is the first step to staying ahead of problems before they become permanent. Because here's the truth. Aging doesn't mean fading. It can mean deepening, strengthening, and thriving if you choose it. So, as we close this conversation, I want to leave you with one final message. It's not just about your prostate. It's about something far bigger. Let's talk about that now. 6 final thoughts. If you've stayed with me through this entire conversation, I want you to know how much I respect you for that. These aren't easy topics to talk about, and they're certainly not the kinds of things most men grew up feeling comfortable discussing. But the fact that you're still here tells me something important. You care about your health, your future, and maybe for the first time in a long while, you're ready to look at these parts of yourself with honesty and compassion. We've talked about a lot today. We started with the physical, the daily strain on your pelvic floor, the quiet inflammation of your prostate, and how something as routine as daily masturbation, when left unchecked, can start to wear your body down in ways you didn't expect. Then we moved into the invisible, how hormones like DHT can spiral out of balance, how daily habits may unintentionally stir the very conditions you're trying to avoid, and how desensitization can lead you to miss the early signs your body is trying to send. Those signs matter. They're often the only voice your prostate has. We looked at something even deeper, too. The emotional toll. The loneliness that sneaks in through the cracks. The slow drift away from connection. How a habit meant to comfort you can slowly become a wall between you and the people who care about you, or even between you and your own sense of self. These are not small changes. They are the quiet ways life can shrink if we're not paying attention. But I hope you also heard something else today. Not just warnings, but a path forward. I hope you felt that this isn't about shame or judgment or rules. It's about reclaiming something. Reclaiming control not just of your sexual health, but of your energy, your clarity, and your purpose as you move through this chapter of life. You're not alone. You're not past your prime, and you're certainly not too old to make changes that matter. What you do from here, whether it's spacing out your habits, being more mindful during those intimate moments, scheduling a checkup, or even reaching out to someone you've been distant from, it's all part of the same message. You still get to choose the kind of life you want to live. I've worked with thousands of men over the years. I've seen lives improve dramatically, not because of some miracle drug or magic solution, but because someone decided to pay attention, to be proactive, and to treat their health not as a burden, but as a gift. And that gift starts with self-respect. Your prostate is not just a small gland buried in your body. It's a reflection of how you care for yourself, how you listen, how you live. And while yes, it can create challenges, it can also be the reason you stop and truly start caring again. Not just about your physical condition, but about how deeply connected you feel to the life you still have left to live. So wherever you are in your journey, Whether you're facing changes or just getting curious, know this. It's never too late to start paying attention. It's never too late to choose strength over silence, connection over isolation, action over regret. Thank you for spending this time with me. If this message resonated, share it with someone who might need it. We need more honest conversations like this, especially for men like you. The men who've lived, endured, and now deserve to thrive. Your health, your vitality, and your peace of mind are worth fighting for, and I'll be here every step of the way to help you protect them.